Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Amsha Mushtaq Khan, and today I have this opportunity to present on the topic syphilis under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: once you have matured, you realize silence is more powerful than proving a point. Content outline: number 1, introduction to syphilis; number 2, dynamics of disease transmission; number 3, epidemiological determinants; number 4, clinical features and complications; number 5, prevention and control measures; number 6, current global policies and challenges; and recent advances and multiple choice questions. At the end of this presentation, the participants will be able to understand the epidemiology of syphilis, including the phases of disease, complications, and global prevalence, comprehend the dynamics of disease transmission, including its reservoirs and modes of transmission, understand the prevention and control measures for syphilis at various levels of prevention, and recognize the recent advances in the context of syphilis. Syphilis is an infectious disease caused by the bacterium Treponema pallidum and typically progresses through 4 distinct stages, each with its own set of symptoms and characteristics. The stages include primary, secondary, latent, and tertiary syphilis. Syphilis increases the risk of both transmitting and getting infected with HIV, so it is advisable to get HIV testing in all patients with syphilis. Spread of syphilis: one can get syphilis by direct contact with a syphilis sore during vaginal, anal, or oral sex. Syphilis can spread from a mother with syphilis to her unborn baby. One cannot get syphilis through casual contact with objects such as toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, and sharing clothing or eating in common utensils. Risk for syphilis: gay or bisexual man, HIV positive persons, those taking pre-exposure prophylaxis for HIV prevention, partners who have tested positive for syphilis, and all pregnant people should receive syphilis testing at their first prenatal visit. Epidemiological triad, which includes agent, host, and environment. Agent is Treponema pallidum, a spirochete bacterium with various subspecies that cause the disease syphilis, Bigel, and yaws. It is transmitted only among humans. Host: only known natural host is the human. Syphilis is transmitted from person to person by direct contact with a syphilitic sore known as chancre. Incubation period: the average time between the acquisition of syphilis and the start of the first symptom is 21 days, but can range from 10 to 90 days. Clinical features: number 1, primary stage, the chancre. During the first primary stage of syphilis, one may notice a single sore or multiple sores. The sore is the location where syphilis entered the body. These sores usually occur in or on around the penis, vagina, anus, rectum, lips, or in the mouth. Sores are usually but not always firm, round, and painless. Because the sore is painless, one may not notice it. The sore usually lasts 3 to 6 weeks and heals regardless of treatment. Even after the sore goes away, one must still receive treatment. This will stop the infection from moving to the secondary stage. Secondary stage, seen in 6 weeks to 6 months after the primary chancre, usually diffuse, non-pruritic, indurated rash, including palms and soles, look rough, red, and reddish-brown. Other symptoms may include fever, swollen lymph glands, sore throat, patchy hair loss, headaches, weight loss, muscle aches, and fatigue. The symptoms from this stage will go away with treatment. Without treatment, infection will move to the latent and possibly tertiary stages of syphilis. Latent stage. The latent stage of syphilis is a period when there are no visible signs or symptoms. Without treatment, one can continue to have syphilis in body for years. Tertiary stage. Most people with untreated syphilis do not develop tertiary syphilis. However, when it does happen, it can affect many different organ systems. These include the heart, blood vessels, the brain, and the nervous system. Tertiary syphilis is very serious and would occur 10 to 30 years after the infection began. In tertiary syphilis, the disease damages internal organs and can result in death. A healthcare provider can usually diagnose tertiary syphilis with the help of multiple tests: neurosyphilis, ocular syphilis, and autosyphilis. Without treatment, syphilis can spread to the brain and nervous system: neurosyphilis, the eye, ocular syphilis, or the ear otosyphilis. This can happen during any of the stages described above. Signs and symptoms of neurosyphilis can include severe headache, muscle weakness, and or trouble with muscle movement and changes in mental state or dementia. Signs and symptoms of ocular syphilis can include eye pain or redness and changes in vision or even blindness. Signs and symptoms of otosyphilis may include hearing loss, ringing, buzzing, roaring, or hissing in the ears, tinnitus, and dizziness or vertigo. Late benign syphilis, the gamma. The gamma is the most common complication of late syphilis. Gammas may be single or multiple, start as a superficial nodule as a deeper lesion that breaks down to form punched out ulcers. They are ordinarily indolent, slowly progressive, and indurated granulomata with central healing with an atrophic scar surrounded by the hyperpigmented borders. It may be destructive but responds rapidly to treatment, thus it is relatively benign. Late benign syphilis, the gamma. The stages of syphilis, as I've already described, primary, secondary, latent, early latent, late latent, and tertiary syphilis. Congenital syphilis. Congenital syphilis is transmitted in utero after the first 16 weeks of pregnancy. Therefore, it is usually not a cause of abortion during the first trimester. It has been divided according to the arbitrary dividing line of 2 years into early and late types. Early congenital syphilis, the features are similar to secondary syphilis. Usually it occurs 2 to 8 weeks after birth, presenting with failure to thrive, mucocutaneous lesions, condylomata lata, generalized lymphadenopathy, nasal snuffles, and skin rash. Late congenital syphilis, the onset usually occurs at or near puberty. Well-known stigmata include nerve deafness, interstitial keratitis, Huntington's teeth, Huntington's striate, glutone's joint otitis and chondritis, saddle nose, frontal bossing, severed tibia, and perforated palate. Huntington's teeth, the upper central incisors are widely spaced, centrally notched, and tapered in the manner of a screwdriver. The molars may show multiple poorly developed cusps, that is, mulberry molars. Newborn with congenital syphilis. Congenital syphilis can cause miscarriage. Congenital syphilis can cause miscarriage, losing the baby during pregnancy, stillbirth, a baby born dead, prematurity, a baby born early, low birth weight, or death shortly after birth. Up to 40% of babies born to women with untreated syphilis may be stillborn or die from the infection as a newborn. The levels of prevention, primary, secondary, and tertiary. Primary reduces the risk factors before occurrence of disease, condition, or injury. Secondary, early detection of the potential for development of the disease or condition. And tertiary, treatment of an existing symptomatic disease. Prevention and control strategies for sexually transmitted diseases include organization of sexually transmitted disease control, primary prevention, school health education, and mass media for health promotion and prevention of sexually transmitted diseases. The primary prevention includes health promotion. It includes strategic areas such as promoting public health policy, promoting a supportive environment, strengthening community action, promoting healthy personal behavior skills by providing information, education, and counseling, orienting health services toward meeting all the patient's needs, specific health education programs regarding safe sex, using condoms, reporting for early treatment, and strict compliance. All these factors prevent further transmission of disease. Specific protection. Syphilis is unique among sexually transmitted diseases in that it remains curable with a single dose of penicillin with no documented risk of resistance. Formulated for this purpose is the long-acting benzathine penicillin G. No vaccine is available to prevent syphilis. Secondary prevention includes early diagnosis and prompt treatment. The syphilis serological assays include non-treponemal assays, VDRL, rapid plasma reagent, RPR, automated reagent test, ART, and troponin-specific assays including FTA, ABS, and MHA-TP, and automated troponin pallidum enzyme immunoassay. This is a standard protocol for syphilis screening and diagnosis. For example, the non-triponymal testing, including RPR or VDRL. If the result is positive, then the triponymal tested is conducted, and if the result is ultimately positive, then we have to assess the patient for treatment. Syphilis can affect brain and other organs, but the good news is that it is curable with antibiotics. For primary, secondary, early latent syphilis, the recommended regime includes benzathine penicillin G, 2.4 million units intramuscular. In case of penicillin allergy, doxycycline 100 milligrams twice daily for 14 days, or ceftriaxone 1 gram intramuscular IV daily for 8 to 10 days. Limited studies suggest the use of ceftriaxone or azithromycin 2 grams single dose in the congenital syphilis, proven highly portable disease, aqueous crystalline penicillin G in 100,000 to 150,000 units per kg per day, administered as 50,000 units per kg per dose intravenous, 12 hours during the first 7 days, and thereafter 8 hours for 10 days. Or procaine penicillin G, 50,000 units per kg per dose intramuscular in a single daily dose for 10 days. Now, the summary includes the Treponema pallidum infection causes primary syphilis, which leads to secondary syphilis if it is untreated. Secondary syphilis can lead to latent syphilis if it is untreated, and ultimately, latent syphilis can lead to tertiary syphilis or can resolve if treatment is adequate. Neurosyphilis, ocular syphilis, and autosyphilis can occur at any stage. Recent updates. Global health sector strategy on sexually transmitted infections towards ending sexually transmitted infections. The Global Health Sector Strategy on Sexually Transmitted Infections 2016 to 2021 builds on conclusions from the evaluation of the implementation of the global strategy for the prevention and control of sexually transmitted infections and sets out a vision, goals and targets, guiding principles, and priority actions for ending the sexually transmitted infections epidemic as a public health problem. The global elimination of congenital syphilis, a rationale and strategy for action. The overarching global goal of the present strategy is the elimination of congenital syphilis as a public health problem. This would be achieved through reduction of prevalence of syphilis in a pregnant woman and by the prevention of mother-to-child transmission of syphilis. The strategy rests on 4 pillars. Number 1, ensure sustained political commitment and advocacy. Increase access to and quality of maternal and newborn health services. Number 3, screen and treat pregnant women and their partners. And number 4, establish surveillance, monitoring, and evaluation systems. Triple elimination initiative of mother-to-child transmission of HIV, syphilis, and hepatitis B. WHO's commitment to this global effort catalyzed maternal and child health services to expand their capacity to address vertical transmission of other communicable diseases, including hepatitis B, syphilis, and HIV. This culminated in the Triple Elimination Initiative, which encourages countries to simultaneously commit to EMTCT of HIV, syphilis, and hepatitis B, further pushing the agenda for integrated service delivery. Essential triple elimination of mother-to-child transmission of services include testing for HIV, syphilis, and hepatitis B virus in antenatal care clinics, prompt and efficacious interventions to treat women who test positive and to prevent transmission of the infections to their children, counseling for women and their partners to reduce transmission risk and ensure proper treatment, appropriately attended safe delivery, appropriate follow-up of exposed infants, including HPV vaccine burst dose, optimal infant feeding, and lifelong treatment and care for mothers living with HIV or eligible for treatment for hepatitis B virus or syphilis. Syphilis in pregnancy. In 2019, 1% or more of the antenatal care attendees in 38 of 78 reporting countries tested positive for syphilis. In these 78 reporting countries, an average of 3.2% of antenatal care attendees tested positive for syphilis. Syphilis in pregnancy is the second leading cause of stillbirth globally and also results in prematurity, low birth weight, neonatal death, and infections in newborn. These adverse outcomes can be prevented with a simple and inexpensive rapid test followed by treatment with benzathine penicillin. New data suggests sexually transmitted diseases continue to increase during the first year of the COVID-19 pandemic. Congenital syphilis increases in the USA. The rising congenital syphilis numbers in the USA reflect the reality of the nation's syphilis epidemic and the growing trend of syphilis infections among women and their male sex partners. Syphilis is not only the sexually transmitted disease that is increasing in the USA. According to the CDC, there was a nearly 30% increase in chlamydia, gonorrhea, and syphilis between 2015 and 2019, with the sharpest increase in cases of congenital syphilis, with nearly quadrupled during that time period. The National AIDS Control Program, Pakistan, the heterogeneity and interlinking of high-risk injecting and sexual behavior combined with low levels of HIV knowledge and prevention and high levels of other sexually transmitted infections. A few of the main objectives of the National AIDS Control Program are as under. Number 1, prevention of HIV transmission. Number 2, safe blood transfusion. Number 3, reduction of sexually transmitted disease transmission. And number 4, establishment of surveillance. Now the multiple choice questions. Number 1, a 28-year-old woman presents with a generalized rash that includes the palms of her hands and soles of her feet, mild fever and fatigue. She recalls having a painless genital ulcer about 2 months ago, which healed on its own. The most likely diagnosis is a sexually transmitted disease caused by A, hepatitis HIV virus, B, Treponema pallidum, C, Neisseria gonorrhoeae, D, Plasmodium falciparum, and E, Chlamydia trachomatis.
B. B.
Yes, the answer is B. A 35-year-old man presents to a sexual health clinic after noticing a single painless ulcer. Upon physical examination, the clinician notices a well-defined round ulcer with a clean base and firm indurated borders. Given the presentation and history, the clinician suspects it might be a chancre, indicative of primary syphilis. The possible locations for this type of ulcer might include A, throat, chest area, and vagina. B, genitals only. C, buttocks, back, arms, and legs. D, genitals, anus, rectum, lips, and in the mouth. E, scalp, neck, and underarms.
D. D.
Yes, the answer is D. A public health physician advised the local health department on developing guidelines for early detection of syphilis. It is emphasized to get serological testing for syphilis detection. According to it, the antibody test generally turns positive 1 to 3 weeks after the appearance of a certain characteristic lesion. The corresponding stage of syphilis is A, tertiary syphilis stage, B, secondary syphilis, C, primary syphilis, D, latent syphilis, and E, congenital syphilis.
C.
No, the answer is C, primary syphilis. It is basically the scenario concerning chancre. Particular stage of syphilis that is both asymptomatic and typically non-contagious unless it's in its early phase. This phase can last for several years and may precede a more severe stage of the disease. The stage being referred to in the scenario is A, primary syphilis, B, secondary syphilis, C, latent syphilis, D, tertiary syphilis, and E, congenital syphilis.
A. C. C.
C. Yes, latent syphilis.
C.
A dermatologist consults a patient exhibiting symptoms of secondary syphilis. The patient reports skin rashes and also presents with oral lesions. The doctor explains to the patient that several types of oral lesions can occur in secondary syphilis, except A, snail tract ulcers, B, mucus patches, C, chancre of the tongue, D, Huntington's spots, and E, gumma.
E.
E. Answer. Yes, the answer is C. A patient reports a generalized skin rash that is symmetrically distributed on the flexor aspects of the arm, flanks, and palms. The rash is painless, indurated, and pleomorphic in nature. Additionally, the patient is exhibiting lymphadenopathy. All of these are the characteristic symptoms of A, measles, B, rubella, C, chickenpox, E, smallpox, and secondary syphilis.
Secondary syphilis. E.
Yes.
Secondary syphilis.
Yes. A chronic infectious disease transmitted from an infected mother to the fetus before birth, known as congenital syphilis, has several typical manifestations of the following. Not a characteristic of congenital syphilis is A, bone complex, B, interstitial keratitis, C, mulberry molars, D, notched incisors, and E, saddle nose deformity.
A. Gone complex.
Gone complex is a characteristic of TB. Complications of untreated syphilis include general paresis, a condition characterized by personality changes, cognitive decline, and motor symptoms. The stage of syphilis that general paresis is usually associated with is A, primary stage, B, latent phase, C, secondary stage, D, tertiary stage, and E, congenital.
D, tertiary.
Yes. An oral and maxillofacial surgeon is consulted for a patient with paleness, perforation in the palate. The doctor explains that when encountering such a case, the first consideration in the differential diagnosis should be A, syphilis, B, histoplasmosis, C, scrophuloderma, D, actinomycosis, and E, tuberculosis.
A.
Yes,
A.
the answer is
A.
A. A 30-year-old woman presents to the outpatient department. She reports having had a painless genital sore about a year ago, which resolved on its own. Now she is asymptomatic. The attending physician needs to determine if she is currently in the latent stage of syphilis, even in the absence of symptoms. The diagnostic test most appropriate to confirm this suspicion is A, urine test, B, spinal tap, C, serological test, D, saliva culture, and E, throat swab.
C.
C. C. This is the key of the MCQs. This is the YouTube link of the our YouTube channel, and thank you very much.
Okay, thank you very much, Dr. Ramsha. Very nice presentation. And the best thing is that you have given the recent advances. We know that the syphilis is one of the disease that has caused loss of life, and also it is associated with loss of very productive years. It is very much prevalent in third world countries and in developing countries, and still there is a lot of preventive measures that has to be taken. We know that both primary and secondary prevention has done wonders, and the tertiary prevention has not been as successful as primary prevention, and there is a very good role of antibiotics, especially penicillin group, tetracyclines, cephalosporins, carbapenems, and now we are heading towards the cephalosporins. So these all drugs, they have a very good role in preventing, controlling, and combating all the complications of this disease. Another important role is of preventive measures that must be taken, especially in the life that is the most youthful, and is causing most of the disease that is being transmitted in reproductive life years. So very well done and very good presentation. Thank you very much, and Allah Hafiz.
Allah Hafiz, ma'am. Thank you.